Hey friends, I am Dr. Anne, an anesthetist, and welcome to another dose of happiness and health. We are going to be playing a few video games, and let's see if they are really based on the truth, if they're really facts, or maybe they're just someone's imagination when they made that game up. So maybe we can learn something in the process. So let's dive into the video. First, we're going to be playing this game Operate Now, the hospital edition. So let's see how that's going. Okay, I see that I have a gaping wound to start with, and okay, so now I have to suture his abdomen. Let me try my suturing skills. This is harder than it looks. I have never played video games since I was a kid, so looking at this video, I don't see them suturing it. They're actually stapling it, because if it was a suture, then you should be able to see the knot on top. So I don't think that's really suturing, so we may call it stapling. And coming to suturing, there are different types of suture materials. There are absorbable suture materials, there are non-absorbable suture materials, and it depends on what's required. Like if you're having sutures outside on your skin, you might have non-absorbable, because you can have the sutures removed after a few weeks, depending on the site where you have your injury. And absorbable suture material, when it's inside your body, you won't be able to get them out later. So we use absorbable suture materials when we're using inside the body, and there are lots of absorbable, non-absorbable. I don't want to get into the details. There's just a little gist about suturing. Okay, next I'm going to reconstruct. Oh, okay. I'm gonna apply antiseptic, fine, and then I make an incision, clean incision, nice. Now the bone is all broken. No, why are we taking that out? Oh, I have to play jigsaw with the bone. My goodness, this is not how surgery is done. Far away from the truth. Okay, now I have to keep a plate, and yeah, that plate doesn't seem sturdy at all. Okay, let's just play along. And I'm closing the wound, and I clean up, and congratulations, it says congratulations dog, you did a good job. No. Okay, there's so much wrong about that video, and I have to say it here itself that it is not true what's happening over there. You don't play jigsaw with a bone. That's not what orthopedic surgeons do. Ever since I finished residency, I have only been going for orthopedic surgeries, so I know quite a lot about surgeries, of course, but I'm not an actual surgeon, so I can't say that everything I say over here is the fact. But I have watched quite a lot of surgeries, being an anesthetist and being always being there for orthopedic surgery. So this is not how someone closes a fracture. Look at this bone over here. It actually seems pretty fine. It's all confined in the space where it is, and it's pretty fine. So I don't understand why they're taking it all out and playing jigsaw with it, because if you take the pieces of bone outside, then the bone will lose its blood supply. You will be pulling it away from all the muscle attachments, and so where will the muscles attach? It's never advisable to remove a bone from the muscle attachment when it's not really necessary, and it's not necessary for fixing the bone. In a comminuted fracture, it's comminuted means it's all crumbled, it's broken into too many pieces, but the bone, when it forms, all the pieces will join together and form something called the callus, and then it will form the bone, and it's not necessary that you have to play jigsaw with the bone. Also, I would like to emphasize that being an orthopedic surgeon is quite hard. It's not as easy as playing a jigsaw on the computer, especially with when you're inside and all the bones are crumbled up, and you have to fix them together and get them aligned. So let's see the next one. Another fracture. Okay, I'm going to go for the leg now. As you can see, this fracture is not too bad, and you can just make it straight where it is. You don't have to take it all out and play the jigsaw all over again, because if you take it all out, the first thing I already told you, the bone will lose its blood supply and it's all its muscle attachments. And again, when you take it all out, you don't know how long the leg is supposed to be. So when we play jigsaw together, what if it the length decreases by 1 centimeter? You will have shortening. 1 feet will be shorter, one leg will be shorter, and you will have to limp and walk. So that's not something surgeons do, orthopedic surgeons do. So let's see how this game goes. Okay, look at that plate. Look at that plate. Okay. Now I have to talk about the plate now. It was so annoying watching this video and playing along with it. Okay, the first thing, you don't take the bones out like you play a jigsaw, and second, you don't use such a small plate. You see the plate, it's not all the way across. It just fits the fracture site, and there's no hold, right? All the pieces, there's nothing to hold on. So you have to keep a longer plate so that at least 3, 4, 5 screws are in the normal bone, so that you have a grip when you're having the bone. And you also have to mention that the most common implant you use for a femur fracture, the fracture they are repairing here, it's not a plate, it's a nail, but you can use a plate also. So I wouldn't talk about, I don't want to comment about that. But you have to use a longer plate because there is no stability. You can't, it's not stable, it will still all be wobbling because all these fracture pieces, they're all separate, and now you're just gonna place a plate on top. No, that's not how you do it. Got another bone fracture. Jigsaw, you don't play jigsaw. This isn't like the real fracture fixation at all. You never play jigsaw. What about all the arteries and nerves that go near the bones? Playing jigsaw like this, you'll injure them all. Okay, the plate is short again. You see, there has to be at least 3 or 4 screws. Okay, so I found another game, and so I thought I'd play that also along with you guys. This is the ER surgery simulator. So let's
calling
see what
all
we have
surgeons to lend a hand. The roads are blocked, and Allison's baby is due. Surgeon, do a C-section. She's counting on you. Don't worry.
Okay, I'm going to stop it right there. Why do you want to do a C-section if someone's having a baby? That's not how everyone has their baby. You go for a normal vaginal delivery. Unless you have a real indication to have a C-section, you don't have to have a C-section. So I don't want to operate on this patient. Shall I just move over to the next one? Okay, let's just play along.
Everything will be fine. He's counting on you. Nurse, let's
put
under. Everything will be fine. Nurse.
Wow, in this game they actually have an anesthetist putting the patient under. That's what anesthetists call, to give anesthesia to someone, and they're actually saying, nurse, let's put the patient under, but they are giving anesthesia in the stomach. I don't know what they're doing. They're giving a nerve block. We usually go for spinal anesthesia or maybe epidural, but I don't know. So let's just play and see what happens. Okay, the anesthesia. Okay, marking. Well, we don't really have to mark, it's just give the incision.
Okay,
let's open her up. I think the marking is for us to know where to put the incision, because everyone might not know where to put the incision.
Hand me the spreaders.
Okay, retractors. We just cut open only the skin and then we're all the way into the uterus. No. First you cut the skin and the fascia and the muscles and the peritoneum and then the actual uterus, and finally you get to the baby, and then but here we're already at the baby. Let's play along.
Let's pull him out.
That's crying. Okay.
Nurse. Cord.
No. You cut the cord without clamping the cord. Oh, now the baby is going to be bleeding from the umbilical cord and it's going to lose blood and it's going to be anemic. You have to first clamp the cord, both sides, and then cut the cord, because you don't want bleeding from both the sides. So let's continue. Oh, we're using staplers. That's nice. But
Let's stitch
You
her
have to
up.
close all the layers. You have to close the
Let's
uterus
stitch her
and
up.
then the muscles and then finally the staplers. And you can't staple the uterus and all. You use staplers only on the skin. Others you have to suture. So they forgot that part too. But it's just a game, so it's fine. Okay, but they should definitely clamp the cord.
Mom, meet your
can't
new
do it
baby
without
boy.
Great job.
With the knife, open heart. Be cool with your hands and steady with the knife. Open heart surgery. Give him the
Open heart surgery. Oh my
Nurse,
god,
give him the
anesthesia
anesthetics.
again over there. Giving local anesthesia for everything. Open heart, you'll have to be under gentle anesthesia. You can't go with local anesthesia like that. At least they're giving anesthesia. The other game they didn't have anesthesia at all.
Open him up
No,
slowly.
where's the sternum? Where are the bones in the chest wall, the muscles? Oh, you just cut it without clamping anything.
Okay, let's take it out. Almost
What
there.
is
Place
that?
it inside. Place it inside.
We're playing connect the dots now. Okay.
Now let's bring it back. Close
Okay,
him
so
up
now
and
the-
we're done.
Now the most common open heart surgery is not heart transplant as they're doing over here. It's just coronary artery bypass grafting where your coronary artery, you keep a bypass graft to when there's a block in one of the coronary vessels. And yeah, I don't know why they're doing a heart transplant. Maybe if they have some condition, but I don't know. But I'm sure everyone watching this, you by this time you would have realized that open heart surgery is nothing like this game, right? Because it just goes to remind us that this is just a game.
And we're done.
Okay, so that's it for this video. So I hope you learned a thing or two, and I had fun playing those games. Maybe you can play those games out, but just remember those are just for kids, medical students. But just remember, it's just a story, it's just a game, and it's nothing like the truth. Actual surgery is far more tougher and takes years of training to perfect all the skills. And hats off to all surgeons who have been through years of training and are doing such a great job saving lives. And so see you again in the next video. Don't forget to subscribe, you guys, and bye.